So chemotherapy is typically used to shrink tumor burden in cancer patients. But sometimes chemotherapy doesn't work. And why? Because there are chemosensitive cells, which means they kill the cancer cell, but then there's a large group of population called the chemoresistant cells, and they all exist at the same time. In fact, there's a test that can be done called the multi-drug resistance index. And so that tells me that the patient has a large group of chemo-resistant population. So when you give chemo, you're going to have chemosensitive cancer-killing cells, and then you're going to have chemo-resistant. Just like typically when you give antibiotics, you have antibiotic-sensitive organisms and you have antibiotic resistance. That's why they're saying that we've used so many antibiotics over the years that they become resistant to the typical antibiotics. So now we have superbugs that are being created. So that's why we want to be really, really conservative about utilizing antibiotics. So the same concept applies to chemotherapy. Chemotherapy can be very effective in shrinking cancer cells and shrinking tumors in the body, but it also sometimes may not work for you. That's why I use the RGCC test, which is the cancer test. It's the most sophisticated oncology testing in the world that I have used. I've used all different kinds of testing, and it tells me specifically what the cancer cells are sensitive to and also the multi-drug resistance index. So we always have to give the patient things to prevent the chemo resistance. So that's why sometimes it's not always effective.